A massive independent review of the state's COVID-19 response finds New Jersey's lack of preparedness led to unnecessary deaths and suffering. The long-awaited review out this week fulfills Governor Murphy's promise to provide a post-mortem on the most dangerous pandemic in a century, which sickened nearly 3 million people statewide and killed more than 33,000. The roughly 1,000-page report gives credit to the pandemic's heroes, but criticizes the state government for a patchwork response that hit the most vulnerable in New Jersey the hardest. And as senior correspondent Brenda Flanagan reports, reveals that even in the years since, the state still hasn't come up with a future emergency plan.
Leadership would have made a difference.
Jay Boxwell spent anxious hours at Jersey's veterans' homes demanding action as COVID's first surge cut like a scythe through the state-run facilities in Menlo Park and Paramus, killing almost 200 residents in April alone. By September, grieving families and angry staff knew something was very wrong.
Horrible. They want us to work without masks because it's going to scare the resident. And when we see they're just dropping like flies, that's breaking our heart.
State officials witnessed that tragedy unfolding at the vets' homes and at long-term care facilities where more than 16,000 died, most of them elderly and vulnerable. The governor promised a full accounting, which arrived this week in a massive report that documents New Jersey's response to the pandemic. At the two vets' homes, it found systemic failures, poor infection control, lack of employee confidence in leadership, and management incompetence.
Menlo Park and Paramus at the beginning had soldiers running those facilities. Okay? They did not have clinical healthcare background whatsoever.
But if we would have had some skilled leaders in those positions, I think we could have minimized the impact that there could have been for some fragile individuals that passed away unnecessarily, I feel.
The report blames the federal government for failing to provide critical guidance and says COVID caught New Jersey's healthcare system off guard and woefully unprepared. It notes that by February, the virus was already out, spreading like wildfire through the community, infecting long-term care centers.
There is like an admission of things that went right and that things that went wrong. So we should have been reacting in real time to those situations, and we weren't. And so how does the report tell us about how to do that effectively in the future? I don't think the report tells us that at all.
It does describe how patients overwhelmed hospitals already struggling to find protective gear, so health officials hoarded masks for medical centers, and in the early months, nursing homes went without. David Adenaro was an assistant health commissioner during the pandemic.
Nobody had enough PPE. I think that's one of the really important things that's stressed in the report, which is that preparation and proper stockpiling is going to be important, not just for New Jersey, but also for all other states, and in particular the federal government.
The report commends the governor's quick response, locking down the state and closing schools, but it adds letting individual districts decide when to reopen classrooms contributed to learning loss because urban districts couldn't provide the required social distancing. Overall, COVID hit low-income minority communities much harder, underscoring pre-existing inequities, the report says.
And I think it talked about employment status, for example, and how certain occupations were more likely to be exposed and have less access to healthcare. Well, those were almost, at least early on, largely occupied by communities of color and low-income population.
The NJEA responded to the report, noting, "We believe that in-person instruction is the gold standard for effective teaching and learning, but that had to be balanced against the very real health risks of in-person instruction early in the pandemic, particularly before vaccines were universally available." The report also says state officials failed to activate an existing flu pandemic plan, leaving local health departments scrambling. Even after coping with COVID for 4 years, the report concludes New Jersey's not ready for the next pandemic.
We have to build the trust, and none of these reports really talk about how you build up a public health workforce that then is going to be equipped to work with people, because people are making the decisions that make these pandemics spread.
Public health experts hope the next administration learns from the deadly mistakes made by this one. I'm Brenda Flanagan, NJ Spotlight News.